Let's say it's public. It's being sent. Does that mean it's going? Does that mean it's out public?
It says live at the top
Yeah.
left corner.
Oh, okay, right. So I didn't read that. Okay.
Here we go.
So we can get started. I'll skip the minutes since we don't have a quorum right now, but maybe someone else will show up. So let's go around and do introductions to start. I'm Jan Lynch. I'm the chair and longtime member of the Community Services Board. Sheila McHenry, vice chair, as well as member of the DD subcommittee.
I'm Mary Hutchins, a member of the board and the mental health subcommittee. And I'll introduce our guest here. This is Jacob Parker Carver, who is interested in one of the openings that we have on the CSB. And he's here to learn about what we do and maybe to introduce yourself, what you do in the community. That'd be great.
Fantastic. I'd be happy to. Should I do that now or wait for later in the agenda?
I'm sure you're gonna do it now.
Okay, great. Hello, everybody. I appreciate you making my job easy by starting the introduction. That was great. Jacob Parker Carver, grew up in Trumansburg. Some folks may know my name from when I was the community mental health educator for the Mental Health Association. I was there for a couple of years before going to grad school and getting my master's in social work. I worked for a few agencies downtown. Currently, I'm the alcohol and other drug services coordinator for Cornell Health. I joined the substance use subcommittee in, I believe, early 2022, and then took over from Stu as the substance use subcommittee chair in 2023. Last month was my first time visiting this space on Zoom. And it just seems like it would help facilitate communication if I were a member of the CSB proper. So here to see what that would be like and how I can help.
I'm Sally McConnell, member of the board and of the Developmental Disabilities Subcommittee. And I'm sort of here as a family member involved with mental health issues.
I'm Nicole Zulu. I am a member of the Community Service Board for a year and a half now. And I'm not on a subcommittee yet, but hopefully soon.
I'm Yaris Friedlander. I'm the deputy commissioner and director of human services. How about Larry? Can you go next?
Oh, sure. I'm Larry Roberts. I'm a member of the Community Services Board and the chair of the Mental Health Subcommittee.
Thank you. Anna?
Hi, everybody. Nice to see you. My name is Anna Tamis. I am a child and adolescent psychologist here in the Ithaca community. I have been on the Community Services Board now for about just over a year. So that's about me.
Thank you. Khaki?
Hi, I'm Khaki Wunderlich. I'm a member of the board and the DD subcommittee. And James and Jeff, I'm sorry I've been missing those meetings. And the time differential makes it not likely I'll be there in the morning, but the next meeting I will be.
Problem whatsoever. Thank you.
Jeff and James, would you like to introduce yourself?
First, Jeff.
Jeff Bowles, co-chair of the DD subcommittee. I'm glad because I can be difficult at times to understand over Zoom. I'm gonna let James do the majority of our report tonight.
And James Beaumont, the other co-chair of the DD subcommittee.
Thank you. We had one more, two more people, just three more people just show up. In a minute, we'll do a few more introductions. We'll let them get set. We're just doing introductions. Would you mind introducing yourself?
Yes, Tom Kelly, Police Chief, City of Ithaca.
Hey, Tina.
Thanks. So, Stu, do you
glad
want to
to-
introduce yourself?
Yes.
Oh, thank you.
I'm Stu Bergman, a member of the mental health board. And looking for a chair.
Augusto Pan,
Hold one up. for you.
member of the board.
Thank you.
Somebody there.
Hello, full house.
I think we.
Oh, what do I have?
It was. Coming down really hard.
Yeah. it was. Okay, so are there any additions or deletions to the menu? To the menu.
Couple of those.
Oh, I'm sorry. I was pleased with the forget.
So I'm Howard Reed. I'm a member of the board. I'm gonna be a member of the trustees. That's what.
Yes.
You can.
I'm Lady Brown, legislature, the lead sign with
I'm Jenny Sutcliffe. I'm the new whole health commissioner. Nice to meet you all. Thank you.
Yeah, we have a little section.
This is my first day. I literally, I didn't prepare, and so I had to get snacks from the vending machine. And B, I walked here this morning and it was a beautiful day, so hopefully it's raining by the time I have to.
And stop.
Yes, good.
Car for about good 10 minutes, been there, settle down.
Did you get to introduce yourself?
Yeah.
Okay, I want to make sure since I overlooked you before.
I did. Augusto.
I thought you did.
I did, yes.
So, now instead of additions or deletions to the menu is additions or deletions to the agenda. Does anyone have any? We have enough people to do approval of the minutes now. Quorum. So anyone who has had a chance. Look over the minutes. Do I have a motion? Sheila. Second. Mary,
Jen, could I just say that though I would love to have been at this meeting, I was not actually present. I'm listed as being present. Here in spirit, but.
okay.
That should be correct.
Are you taking that down for Harmony or for? Yes. Brown, thank you. Okay, so we have first and a second. All in favor? Okay. That's everyone, so that's all set, thank you. Privilege of the floor, any questions, comments, or announcements from the board or our guests? I just want to say that Finger Lakes Independence Center is having a mural painted on the front of the building. And we're having a paint day on Saturday, July 12th. And we're also celebrating the 35th anniversary of the ADA. So anybody is welcome to come for 5 minutes or the whole 5 hours. It's 12 to 5. Anyone else have anything? Okay, then we have no board correspondence or announcements. So next on the agenda is welcome Whole Health Commissioner Jenny Sutcliffe. So maybe you'd like to tell us a little bit about yourself. I think most of us have seen the article, but it'd be great to hear from you.
Yes, certainly. So thank you so much for inviting me to be you all. It's really nice actually that this is on my first day and sort of early on. My name is Jenny Sutcliffe. I grew up locally. I went to Trumansburg with Jacob. And I have really worked in government my whole career. My first job right out of college, I was really fortunate to work in the governor's office in the state of Illinois, where I had the chance to really sort of grow there as a person and professionally. And I worked on the Affordable Care Act implementation, which is kind of really what got me into healthcare and public health related work. I got a master's degree, went back to the governor's office for a little while, and then did a little bit of international stints, and then landed about 8 years ago at the New York City Department of Public Health. And I worked there throughout the duration of COVID, where I worked both initially sort of on Medicaid policy, really specifically, And then also, I moved into the world of emergency preparedness and response, where I spent the last few years of my career as sort of a senior advisor on emergency preparedness and response, but in a role that was really leading an agency-wide strategic priority. But I'm thrilled to be sort of bringing my work back to Tompkins County. I particularly, I have a real soft spot for a lot of the mental health work. And I think one of the most, I shared this sort of in the interview process, I think one of the proudest things in my career is that I was the lead for the vaccine rollout for all of the congregate setting sites for New York City. So that included all of the OMH supportive housing sites, the Oasis sites, Oasis congregate residential, all the OPWDD group homes. And so particularly through that work and also through a lot of PPE distribution that we did for those sites, I really got to be quite close with a lot of the O agencies and the work that they do. And I think that that is tremendously important. And I also had a really amazing experience, if you will, when we were rolling out the Affordable Care Act. I worked particularly really closely with our justice system to sort of bring Medicaid enrollment, which was brand new at the time in the state of Illinois, both to the reentry process so that folks who are coming out of the Illinois Department of Corrections were enrolled in Medicaid before they were released. And then also really working with a lot of the service providers and the court systems to think more about how they can leverage Medicaid as a new benefit for their clients and populations. So those are sort of my two specific mental health experiences and work, but I'm really thrilled to be here and really excited to kind of join you all and begin to tackle some of the things that Harmony's been leading in the mental health division and think through some of the other tricky challenges you all have been facing and be a champion for the work that you're already doing. So thank you. Was that good? Did I cover enough good stuff? All right.
You probably have that spiel down. Does anyone have any questions for Jenny? I covered it all, huh?
I just think it's probably a little bit cruel to kind of, ask.
It's allowed, it's allowed. It's part of the job, being able to think on your feet.
Okay, I don't see anybody on there that have any questions. So the next part is the Developmental Disabilities Subcommittee update, and Jeff Bowles and James Beaumont will be giving that information to us about what they've been up to.
Thank you. Can you hear us okay?
Yeah.
Yeah.
Excellent. So the first update we wanted to talk about was that we did have our resource fair after the last time we presented. We moved the location to the Boynton Middle School at the end of May. It was a really good event in that all of the providers that we invited, except one, showed up. So we had a lot of representation of resources for the community. Didn't have a great turnout from the community. So, kind of low numbers there. But we were able to, from that event, come up with a pretty comprehensive list of all of the providers of DD services in Tompkins County. And we've been talking to Harmony about where that resource list could potentially live on a website, because obviously a one-off event once a year is going to really give limited information to people who are seeking services. So we wanted somewhere that it could be and be able to direct people there when they are in need of services throughout the year. So we were excited about that. And we did have a follow-up meeting as a planning committee to discuss what are some ways we can try to improve it next year. And we had some really good ideas of, physical advertising and using different language. We have a parent on our DD subcommittee who was giving really good feedback as far as these are the words, the buzzwords that I would be looking for as a parent that I feel like would drive a lot of people to that kind of event. So we are excited that we've done it 3 years in a row. So, we're making sure the event continues to happen and just continuing to improve on it. So that was the first piece we wanted to go over. Jeff and I have also been talking a lot about what are the discussions and the topics that we talk about in each subcommittee. And I feel like kind of the last 3 years, Jeff and I keep, pounding the pavement and thinking things to discuss. And we feel like we have really kind of talked about 11-ish things over and over again. And our goal as co-chairs is to look at having that be a regular theme each month. So, as we forecast 2026, okay, here are the 11 topics that we're going to go over during the course of the year. Here are the people who have generally we've brought in to have those discussions as a group, and just pre-plan on bringing them back. So that way we're sharing the same information, we're having the same people, and share that info with everybody on a regular basis. Obviously lots of opportunity to have things get plugged in, and as things come up, share that info, but try to create a regular agenda throughout the year to help share info. And with that being said, our meeting tomorrow is going to be a big one that we continue to talk about, which is housing. So if those of you who don't know, a provider of services in the area, Groton Community Home Healthcare, just closed 2 of their houses. They no longer provide any IDD services at all in Tompkins County. And that makes the 10th house closed or temporarily suspended in Tompkins County. So we're looking at 50 to 60 less beds in this county alone for people with developmental disabilities. So we're going to have a discussion tomorrow about the impact of that, and also what are alternatives, what are other resources that people can reach out to, so that way people know there, hopefully are some options, but also just to be very, honest with the people that are looking for housing, and that's we're actually going to have 2 people from Unity House and Racker discuss that if you're not on the emergency housing list, where that puts you on a wait list, and make sure people are aware if you're going to try to stay in this county that, it could be years before you are able to find a suitable location. So we want to give honest feedback to the people that are looking, so that way they have the correct information and make the decision that's best for them and their family. So that will be our meeting tomorrow, and we'll make sure we have that conversation over and over again, with it being such a high need in the area. But that was our updates, the things that we are working on discussing at the moment. Anything to add, Jeff?
No, that I think it changed very much covered it. And then we just keep on plugging away and
Any questions for us?
Question. Can you name the 11 areas? I'm just curious. If you can,
Yeah.
it's okay.
Yeah, no, Jeff and I sat and we went through them together. So housing's obviously the first one. Day services, so a combination of day hab, community hab, employment services, because we feel like with lack of residential options, a lot of those day services are feeling a lot of the pressure, because there's a lot of people, especially people that live at home with mom and dad, that are trying to utilize as much of those services as possible and comboing them. Obviously the workforce crisis, what are agencies doing in order to try to get creative and bring people in? Aging services, we're finding a lot more people that are staying in place or are getting older and older, and what services are available for them. Transition services, looking at students coming out of school and what opportunities they have. Camp or recreation services, including working on the ADA, giving a training each year to camps on the Americans with Disabilities Act. Behavioral support services, we unfortunately didn't work out, but having the biobehavioral health unit at Upstate Medical do a presentation and talk about what options there are for people with those kind of needs. Transportation, healthcare, advocacy and lobbying. We talked about our survey, when we have that full data to be able to utilize it to talk about how Tompkins County is having more issues than surrounding areas because of the cost of living. And family supports.
That's a lot.
That is indeed.
They're great chairs, I say.
Thank you. We appreciate that.
we try.
Yes, and I try to not be so doom and gloom. We definitely want to make sure as a committee we are sharing resources, talking about what options are available, to make sure people are aware of everything they can utilize.
Stu has a question over here, and then Khaki.
All right.
Either James or Jeff, I heard you say earlier in your presentation about housing, 65 units were taken away with one of the latest, or are those 10 of the latest?
Two houses recently closed that were operated by Groton Community Home Healthcare. So those two houses, I don't have the specifics. I think it was roughly 10 to 12 beds. With those 10 to 12 beds gone, it's probably around 60 beds total that don't exist in the county as of right now.
That's still a lot, yeah.
Yes, very much so.
And then Kathy, who was the other?
Yeah, I was just wondering if you got better sort of reactions from camps and things this year when you reached out? Did we see more impact there?
Yeah, we did a training with the ADA and there was some well attended, so. But we haven't heard anything since, so but it was pretty much well attended.
And our goal with that was to share the information with camps so they know what the law is, but also to share information with families about what other options they have. Self-direction being a big one, that somebody can get a self-direction budget and pay for their own one-to-one staff to go to camp. And that we understand that camps aren't just gonna magically appear with more staff just because somebody has some higher needs, that we're really trying to encourage people to know about those alternatives so that way more kids have access. We hear a lot of stories of parents just being like, I'm not even going to try it because it's just going to be too much. So trying to make sure they know what options they have to give their kids those opportunities.
Is self-direction, is that if you hire someone for that, is it allowed that you can go to a camp and use that person that you've hired or not?
As long as the camp is okay with that, is my understanding. So through self-direction, if I have my own staff, that staff can take me where I want to go and do the things that I want to do. So as long as the staff is acceptable of like, this person's going to be responsible for this child and meets all of their expectations. I've heard several stories of that's how camps are trying to be more flexible and get more kids in with different needs, especially people with higher needs that might need one-to-one. So, but I think it is camp by camp that, has to make that decision.
Okay, thanks. And you had a question, Thomas?
Yeah, I had a question about the facilities that were closing. I mean, is it because of funding? Is it because of just lack of staff or?
100% staff. Just cannot find people to work overnights, weekends, just very, very difficult to find. Some of the houses that are temporarily suspended, 4 of them were run by OPWDD. My understanding, they pay between $23 and $24 an hour, and they're struggling to get people to stay employed in Tompkins County. So it is very much so.
Oh, sorry.
What do we know at this point about what's happened to the people who were living in the closed facilities?
We had on the care managers that help support the Groton Home Healthcare closures. I know Unity House had one person move in there. They were actually, so never happens this way, but a whole house of people were able to move into several beds that were opened at Racker, I believe, in Cortland County. So that worked out great for them. When the state-run houses closed, they generally, their process is these beds are available at these houses throughout the state, and those are the beds that are offered to them. So one of the local council members had a constituent come to them and were very frustrated. They were told essentially by the state, either he comes home and lives with you or this is the house that he goes to. It was kind of a lack of options. When Unity House, when we temporarily suspended services at 2 of our houses, we just had them move into beds in existing houses. We had beds available at that time. And I believe Racker did the same thing. They had beds available throughout their residential programs in Tompkins, Cortland, and Tioga County. So they just kind of spread everybody out through wherever there were openings.
Jenny had a question.
Hi, nice to meet you both, James and Jeff. This is a trend I'm expecting to continue, or you expect to continue?
I would say so. No,
Okay.
no houses have unsuspended services. We've only continued to see more houses suspend services.
And that's because of staffing shortages?
Yes.
Yeah, okay.
Right,
Yep.
like 100% saving and storage.
Yep.
You know,
OPWDD was able to give, I believe it was roughly $860 million throughout all volunteer agencies this past April-May time period. Many agencies were able to give increases in wages. Unity House and Racker were both able to give increases, but generally not quite enough to keep, pace with retail and Cornell and the colleges.
Because Tompkins County has such a high cost of living, as you mentioned earlier.
Yeah.
that's a non-factor to the high cost of living in the county. It's a non-factor for too, right?
Larry?
So, I was gonna say, this is just another example about how New York State can't get it together to figure out how to house people with disabilities.
Right.
It's also part of the ongoing thing that we find, which is it's so much more expensive to live here than any other county next to us.
Right.
I wonder, and I don't know what the agenda for the meeting would be, but I wonder if our state assembly person and our state senator are aware that we're losing so much housing. It might be good to have a meeting with them to see about increasing the wage, if that's really the problem.
Right.
They may have ideas. Sometimes I get a little worried about how much control the agencies take for making decisions, when sometimes it's really important to involve our elected representatives in these discussions.
Right. Yeah. And Jeff.
Excuse me for laughing, Larry, but strings and I was just talking about that before we came on about meeting with our representatives and then bringing it to their attention and seeing what could be done.
Yep.
It also occurs to me that not only should we ask our state reps to come to a meeting, but each of the houses that were closed is in the district of a county legislator, and it may make some sense to invite them if we were to have such a meeting.
Right.
It might be good to inform them. It just seems like we've got to be able to solve this problem.
Right. Yeah. Because again, Jeff and I talking about advocacy and lobbying, using the survey that we've been able to work with the county to try to get data to showcase that it is so much worse here. But talk to local legislators about that. Rates through OPWDD are not based on like what county you provide services in. It's the agency that you work in. So my understanding, Unity House are we've not suspended any services in the Auburn area, but we have in Ithaca. Racker Centers, has not suspended any services in Tioga County or Cortland, but they have in Ithaca. And what are solutions that can be targeted to specifically, agencies that operate in multiple counties but are in the Tompkins County area struggling to provide those services that they're not struggling with in other areas. What does that solution look like?
Randy had a question.
Yeah, so this came up a couple years ago, and I think the county was taken by surprise because the state suspended and closed facilities right here in the city. And I know Harmony did research to find out because they suspended them, they didn't have to notify the health department, only if they closed them. So it was this little leeway. And these buildings are nice buildings. We actually toured 4 of them. One's right down here to Roy Street. It's empty. It's state-owned. So these are state-owned facilities sitting empty, which we're paying millions of dollars to maintain and sit there. There's one up on, was it Hanshaw Road, a really fairly large size one by the Armory. Like there's 12 beds there. It's closed. There's one down by CCE, and that one's, I think, in the process of closing. And there's other houses all over the county that are state-owned. They're just closed. And so, I mean, it's, I think that I agree with James and Jeff. Maybe you need to meet with some state representatives and look at this. It's a lot of beds. It has got to be well over 50 beds. Yeah, it's too bad.
Yeah, it is.
Very much so. And like I said, I do give OPWDD credit in that they are putting a lot of funding towards alternative settings. We are going to talk tomorrow about supportive apartments and supported apartments, which are not 24-hour placements. So try to get people who are a little more independent into non-traditional settings. And that there's also a lot of money funneling through self-direction and other avenues for housing subsidies to try to keep, if somebody is capable of quasi-independence living, and to give them funding for that, or self-direction budgets for, mom and dad who still have a loved one at home, as well as assistive technology, trying to see how technology can keep people as independent as possible and safe. So there are a lot of creative ideas being done, because I do think that this model of 8 people in a house living together with 2 staff on is just not being successful with the amount of funding that is present to generate a certain pay rate that people just at the moment are not willing to do for those kind of jobs.
Thank you so much. Are there any final questions? Comments? You guys are doing a great job, and thanks for the information. We appreciate it.
Thank you very much. Hope everybody has a good night.
Have a good night, everyone.
Bye.
Bye-bye.
So our next part is the review of the 2026 local services plan, and Harmony is going to lead that off.
Okay, I'm gonna start by sharing. So, as you may recall that OMH changed the process, well, OMH, Oasis and OPWDD, all 3 of the mental hygiene services, changed the process a few years ago from having to do a new local services plan every single year to a 5-year plan. And I think that's just been so much more useful. It just felt like all we ever did was plan things, and you didn't have any time to do this process of trying to actually make a difference and do a few things about some pretty significant challenges we face as a community. So this plan started in 2024 and it goes until 2027. And then we'll start the whole 5-year process again in 2028. So this is just a review of the plan we already had approved. But every year we are required as the LGU to review the plan and approve it by the board, and then I can submit it, and then it will get analyzed by the state. So I hit my arrow key and it did nothing. Why is that? Not helpful when your presentation.
That's all right.
It looks good, Harmony.
It just says the front one on it. I'm trying to move to the next slide.
Yeah.
And it won't.
You could escape out of the presentation and then just try it again.
My computer got dropped or
Yeah.
Yeah, and I'm wondering if something
Yeah.
happened to it because, oh,
there you go.
escape.
Oh, there you go.
I just stopped sharing. Hold on.
Okay, so share it again and maybe it'll
Maybe it will have healed itself.
do what it needs to do.
Okay. It'll allow me to do it that way. Why don't we just try that? Is that too small? That's gonna probably be too small. Let me try and make it big again.
If you go into the presentation rather than.
Yeah. Hopefully I don't have to, have to do that every single slide though. Hopefully my ERP will start to work. So just a brief overview for those of you who are new, and then for those of you who've been on the board for a while, you've heard this little spiel before, but I know some of you haven't ever heard it before. Mental hygiene law really is the regulation, the law that we have to look at when we think about the local services plan. So mental hygiene law 507 is used by the state, and basically the state, OMH, OASIS, and OPWDD are required to make their own strategic plans, have their own plans, and they use all of the information from every county's local services plan and the city of New York City. They use all of those plans and they compile and analyze that data to help them identify gaps, needs, and look for patterns so that they know what kinds of services to fund. And they also write their own strategic plan based on their own research, and they go around the state and they have a lot of sessions with the community where you can go and speak. OPWDD is doing that right now for their strategic plan. And that's how they develop their plan. And then we are under Mental Hygiene Law 4116, and that requires the local government unit, the LGU, to develop its local services plan. And we are supposed to look at what does the state say when we do our plan, just like they have to look at what does the local county say. So, oh yay, it worked. OMH has a number of strategic priorities that they say really matter. So I'm just going to briefly go over those, and then I'll talk about the other two O's, so we'll see what they all are. They are concerned about workforce development. We hear that all the time. And they have some prevention initiatives. I'm just going across to the right on the top, the green box there, prevention initiatives around suicide prevention and trauma-informed care. You should be hearing some of these things in our local services plan. They've also been working a lot in the last year about hospital and community connections. They want to improve the coordination around people getting discharged from the hospitals. Chief Kelly, this should be right up your alley. They want to know, they want to make sure that there's good communication so people get access to care immediately when they're discharged from hospitals, that people go to hospitals when they need to be in hospitals, and that we can capture afterwards, the community can sort of capture and help support a person with enough adequate supports. It's not a revolving door at the emergency room. So they are having a lot of meetings with the hospital systems, with GCSs, with other members of the community, other organizations that work closely with people for discharge planning purposes. That started about 1.5 years ago, where they were doing that in earnest. They're very focused on peer support services. They want to have every OMH program have peer services in it, children and youth and families engagement in systems of care to coordinate prevention and treatment services. So every county has a system of care process, and they're really trying to strengthen that in counties. And then housing. A lot of the housing they're looking at now is in partnerships with ESHI, and the last year or so, it's been very special. Their focus has really been on specialized populations. They're looking at people who are homeless. They're looking at people who are coming out of prisons and jails. And they're trying to make sure that people that are, when they're discharged from hospitals, have adequate housing and support services. And they also have crisis services. That's been a big focus of the development of 988. And then mobile crisis services in every county, and the creation of crisis stabilization centers. They also developed an Office of Diversity and Inclusion a few years ago that really focuses on creating equal access and reducing disparities. So those are the strategic priorities for OMH. OASIS, when they just did their strategic plan for 2025, so this is hot off the press, They really used a concentric circle model, and they put at the center the people served and the service outcomes. They want to make sure there's a continuum of care, and that continuum of care remedies systemic racism and is accessible and desirable and effective. That's so their core central strategic planning goal. Then the next concentric circle is addiction service system infrastructure, accountability, and workforce. So how are they making sure that their workforce has the tools necessary to do quality, effective work? And then OASIS reputation and relationships and outreach. I thought that was an interesting one. They really want to focus on being known as the entity that provides the definitive leaders, their language providing addiction services in New York, and serve as a model for others. So they want to make sure that they're outreaching to other agencies, to other state entities, to local communities, and to be much more integrated and much more known for quality work. And then the next circle is really on OASIS infrastructure and processes. They want to be efficient, effective, and have the infrastructure to make sure that they can improve the way they do their work, their workflows, their business. And then finally, OASIS staff leadership and agency culture. They want to be a place where people are engaged in the mission and feel valued. So that's the OASIS focus. And then OPWDD strategic priorities and goals. Oh dear, this is a little bit tinier font. Strengthen our workforce, technology, and collaboration. So I thought like James could just do this slide, because everything James said about what they're focusing on in terms of finding alternative types of housing, trying to be really creative, using technology whenever it's possible. They're doing a lot around statewide recruitment and marketing and workforce focused webinars and podcasts. But you know, at the bottom line, it really has a lot to do with the salary for the direct care physicians that they're really struggling with. So that they're trying to find other partners to work with and be collaborative and strengthen their workforce. Then transform our systems through innovation and change. So they're trying to promote more consistent standards in all of their programs. They're doing some housing initiatives that James was talking about. And they have a health equity and aging initiative that includes a program evaluation, because like James was saying, one of the things they're seeing is a lot of people are aging in place in these programs. Are these programs still meeting their needs? Do they need different kinds of services? And we're seeing that across the board also. So I think when we do our strategic plan, we'll talk about the aging population in some of our programs and what their needs are. Enhance their person-centered supports and services. They want to be more person-centered. They want to make sure that services are streamlined, because there are these long wait lists. It can be really challenging to get access to the front door, right? It's really tough to get in that system. So that's where they're focusing. So we looked at a lot of things. You have this whole list in your packet in the front. We looked at a lot of documents. Some of these are brand new. Some of them are a couple years old. So we've been using them to inform our work. But we looked at a lot of reports from OMH, OASIS, and OPWDD. And we looked at some local data. So our community health ranking roadmap, the community health rankings and roadmaps, says that we're in pretty good shape when we compare to similar rural counties, except for, and we were just talking about that, the exception is the high cost of housing. 21% of people have significant distress in our county because of the high cost of living here. And that's compared to 13% in similar rural counties. So that's a significant issue. And the Tompkins County Community Health Survey, and this is brand new. They're in the process of getting this published now. Mental health challenges are most common among younger respondents, related to high levels of loneliness and suicide ideation. And nearly half of the respondents reporting mental health concerns shared that they engaged in services, but the other half are not engaging in services. And of the half that are engaging in services, there's a portion of them that are dissatisfied with the care that they're getting. So there is definitely work to be done there. Barriers that people identified to care or cost. provider availability, and wait time. I think anyone's surprised by those barriers. And then in the New York State Prevention Agenda dashboard, 14.9% of people are saying that they experience mental health distress frequently. 13.1% are engaging in binge drinking. And overdose deaths involving any opioid is about 27 out of 100,000. We're about 100,000 in our population, or 105,000. So for our county, we have about 27 deaths per year. That has dropped. So when the complete report comes out from the community, our community health survey is a little bit different than the state data. What we have seen over the last couple of years, that number really spiked during COVID, and it is starting to come down. We are getting some success there. So that is the good news. So we looked at a number of reports, and this is the last data one I wanted to talk about. Is the OMH Vital Signs Dashboard. I'll make sure you get a copy of this, because right down at the bottom is a link. What is really nice about the OMH Vital Signs Dashboard, and I will go around and talk to our subcommittees about this as well, is that it gives some comparison data on some metrics that OMH thinks are really important, and it compares your county to other counties. But you can also go and look at the mental health clinic. You can also go and look at the PROS program. You could go look at Family and Children's Service. You can look at other agencies. So you can dive in deeply. And then what you can do is look at data based on race and find disparities in care. And so I'll share that information more deeply with the subcommittees, but I will give you a copy of this report so you can go into the Vital Signs Dashboard yourself and take a look. Some ways we're great. Utilization of medication assisted treatment, or MAT, is 92% in our county compared to 68% on average. Pharmacotherapy for alcohol abuse, we're a little bit under at 6% compared to 9%. Adherence to antipsychotic medications for individuals with schizophrenia, we struggle here. We're at 55% compared to 64%. Follow-up after hospitalization for mental illness within 7 days, we're at 74% compared to 50%. Follow-up after hospitalization for mental illness within 30 days is 82% compared to state average of 66%. So that we're doing pretty well. But are people consistently getting the care they need? Do we have enough resources wrapped around people to help them? And housing is a big part of that scenario there. Follow-up after mental health emergency department visit, however, we're at 42% compared to 49%. And follow-up after mental health ED visit on 30 days is 66 compared to 64. So we get better with the ED visits in that 30-day period of time, but we don't want to lose that momentum with somebody if they're in the emergency room. How are we making sure they're getting connected to services? So some of the stuff I think OMH is doing with these communications with hospitals is really going to help us with this part. We're not doing terribly, but we can always do better. So across all of the counties, those numbers are the numbers of counties that are represented. These are the most common cross-system needs that are identified. So the deep purple it affects OMH, OASIS, and OPWDD. The orange is it's two of those agencies, and the gray is it's one of those agencies. So housing tops the list with 54 counties identifying that as a significant need, because you have to just pick your priorities. You may have lots of needs, you only pick your priorities. Workforce was next, recruitment and retention, followed by crisis services and cross-system services, and then transportation. So those are the top needs.
By all counties.
For all counties, the numbers for all the counties, yep. Mm-hmm. And that's what they're really looking at when they're thinking about what kind of request for proposal, what kind of new program should we develop? They're looking at what are the needs, like they aggregate all that information, they're analyzing it. So that's why our local services plan really matters, because it may not be our money directly, but state dollars flow. And as state dollars might get tighter, we want to make sure that we're really advocating for the things we know are needed. So our local service plan priority areas are workforce, housing, crisis services, cross-system services, non-clinical supports, and transition age youth. And I will try and go quickly because it's a 17-page
Right? And you're like, oh no, she's gonna really exhaust us. So I'm gonna go quickly to your packet you have.
Well, you do have 20 minutes or so.
Well, hopefully there's some questions or some thoughts or some like, let's do this instead, because that's always good to hear. There are in the packet, without crayon here, I can't print in color. So you got light gray and you got dark gray, okay? If it's a light gray, it means it's something we still have left to do this year. We've got about 6 months to get a few things done. And I gotta tell you, your subcommittees are hardworking committees. They do a lot of this work. So if you want to get deeper into the weeds on things, being on a subcommittee is the way to do that, because they do a lot of work and then it comes back to you. But what we have left to do on the workforce goal area is highlight objective 1, highlight the severity of the workforce crisis in terms of advocacy. So everything that was just being said about let's talk to our representatives, like State Senator Leah Webb, New York State Assembly Representative Anna Kellis. What we had talked about doing was writing a letter to our local legislators, so the local legislature, and then writing letters to them. Leah Webb wants our data. She wants to see what we have specifically about Tompkins County. I think the idea that Larry had about, sorry, Larry, I'm giving you my back, of maybe we have a meeting and we invite them, but a letter at least where we're sending them the highlights of all the information we collected in that survey. We had a presentation, Ross did a presentation on the survey data for all of the subcommittees, what we learned. We surveyed all of the agency providers that have, it's a mandatory survey now. If they have any state or county dollars, they have to complete on their workforce. And then we invited other ones if they wanted to do it. And I think we can expand that this year. We'll do that again in the fall. But we learned a lot about what kinds of positions people are having problems filling. We learned about the impact that those workforce challenges are creating in our county. So we have enough data now that we can say in Tompkins County, this is what we know. And I think that the housing issue for OPWDD people is top of mind, because it's just unacceptable that a person lives in a house for most of their life and then they're uprooted. They lose their friends that they've lived with. They lose where they go every single day. You know, we have to find a solution for that. That's just not fair to people. And it's not fair to people who need that housing. If you're on the emergency list, you can expect to be on it for a couple of years. It's really dire. So that, I think, if you want to do more than a letter, if you want to do an invitation, I talked to the Chamber of Commerce about coming and seeing what can they do. The nonprofit sector puts a lot of money into this community. They're a big business too. And we need to use our Chamber of Commerce more effectively, I think. And they're very interested in coming and talking with us. So that's a couple of ideas about workforce. But I think we need some advocacy and we need to come up with maybe some solutions. And people did also give us some of the ideas of what they were doing as agencies to try and combat the workforce challenges, how to improve it. And the state has given COLAs the last couple of years, but when you don't increase anyone's salary for over a decade, it's sticker shock when you have to pay people what they really should be making. And that's the problem, that now it's been so long since they have gotten increases instead of getting an incremental. Now it's a huge amount of money if you really wanted to pay people competitively. And it didn't used to be that way 20 years ago.
Would you say the number one reason is there's just people that we can't hire because the wages aren't enough?
Yeah. And we're talking the state agencies can't hire in Tompkins County. And they pay a lot more than the nonprofits do.
I know that there was a survey done recently that the number one reason people, lower income people don't work because they don't have transportation. They can't get there. So it's kind of a double-edged sword, right? So
right.
You have to make so much money to be able to afford a car, and then you can't get to work because you can't afford a car, and maybe it would pay more, but
A lot of the people that work in programs like this come from out of county. So they rely on transportation that's maybe not so reliable because you can't afford to live anywhere here.
I think this survey also, I think, if I read this correctly, of the 51,000 people who work in Tompkins County, over 20,000 come from outside the county. It's a huge number.
It's a lot of taxes.
So,
That you
the
lose,
point
right.
is, there's transportation coming from every direction into this county. And maybe you bring people in from other counties and maybe you work at transportation, so it's more affordable for that, but, yeah, when I read that, I was shocked.
There's been discussion about, there's a lot of affordable housing. I know Corinne had mentioned to me when she grew up in the city that a lot of the unions would build housing and it would be more affordable for the workers. Like that you could maybe do discounted housing for people who worked in human services or something like that. Like, because we have to start coming up with some solutions, because it would be great for those people to actually live here and contribute outside of work, right? Because they're people who care about their neighbor. They are contributing people. And if you're driving 2 hours every single day, you're exhausted, you're going to eventually want to work closer to home. And so if we really wanted to create a sustainable solution, I think it's going to be a couple of different things that we're going to have to think about doing. But that's, I think, our biggest problem right now is this housing for really just the most vulnerable people. So those are some ideas about, I think the workforce crisis, though, the survey data shows it's not just OPW, it's OASIS programs. It's like trying to get, we just had the hospital come and talk about the Crisis Stabilization Center. They're going to have to hire staff, and they're as worried about hiring staff as they are that the contractor is going to build the walls right and that everything's going to come in on time, and or maybe even more so concerned about hiring staff. And it's at all levels of employment, from the executive positions, the medical positions, to the direct care staff. There's challenges. There's challenges for people who can't buy a house here, who are going to make pretty decent wages. But compared to where they come from, it's sticker shock. And they, so that's a big one. I don't want to beat it too much here, but that's a challenge. And then our workforce diversity efforts this year in the survey, we're going to add some more questions to it. And the questions are going to ask agencies, tell us what are you doing around to improve diversity of your workforce. If you have a lot of hiring, you need to fill a lot of positions. What are you going to do to ensure that you're going to have a more diverse workforce when you do that? And what are some of their needs? What do you need? Consultation? Do you need specialized training? Do you need some support around making a more diverse workforce? And that helps us fulfill two of our objectives. One is under workforce, and the other one is under our non-clinical supports, goal number 5, objective number 4. So those we still have to finish up for this year. And then for cross-system services, goal area number 4, it's objective number 1, improve public awareness of available services across systems, including those that address social health needs. It's objective number 1 under goal area 4. So Larry just had Samantha, who's helping us tonight, come, and Shannon, who works with Samantha from Whole Health Communications, and then Monica from the county, who's the communications person for the county, came and presented and had a long conversation about, what are some strategies to effectively communicate to people about getting their treatment, getting their mental health needs met. We just learned that 50% of the people who say that who acknowledge they have a mental health problem aren't getting services. How do we make people aware of services that are available, better aware of them? How do we address some of the barriers and the conversation turn to stigma? And how do we minimize stigma that people might experience? So from that meeting came the idea of creating a communications plan, because
typically it's like something happens in the community somewhere and then there's an article that's written, something gets written because something happened. And then we advise the public about this. Most recently, there was about wanting to make sure parents were informed about substance use that kids might get their hands on that could be really dangerous. But what if we did a plan instead and we're really thoughtful throughout the year and had a regular communications plan? So we're going to establish one of those. And then we're going to talk about the possibility of partnering between our subcommittees, Community Services Board, and Whole Health's communications team. And maybe we can do an anti-stigma campaign and do that in 2026. But at least get a communications plan done. So objective number 5, I think in cross-system services, was added after the closure of Alpine Drug Council. And it was to make sure that we kept on our mind that we reestablished a withdrawal and stabilization program in Tompkins County. And we just had, Jake just had Cuga Health come and talk about, and Cuga Addiction Recovery Services, that's a part of Cuga Health, come and talk about getting that program up and running because they won the RFP. And did they say it's going to be by the end of the year or?
Fingers crossed,
Fingers
by
crossed.
December.
Mhm.
Frank warned that, things could not go as quickly as they hope, so that's tentative. But we'd love that to happen by the end of the year. I think the staffing thing is
Staffing
again,
was
the hardest thing to make promises around.
Yeah, yeah.
Not to be echoing you too hard. Same phenomenon.
Yeah, I think the staffing thing is definitely a concern there. And then goal area 5, non-clinical supports. Objective number 2. We still have improved access to quality mental hygiene services for minoritized populations by completing an analysis of current state and local data available to identify gaps in access to care. So I was showing you that dashboard that OMH has, that when you do a deeper dive in it gives you that information. There's some other state sites that give data. I think the OMH one's probably really good in terms of drilling down deeply at a very local level. But I will do a presentation for all of the subcommittees so that they have that information of what does the data tell us so that we have a better sense of what does the data tell us are the problems. And I don't know, maybe we can also reach out to the hospitals, see if they have, I know they've been working on collecting some information too, and some of our other partners to see what do they have about local data so we can just identify, here are the areas we want to improve. And then next year we can start thinking about, okay, what would be some strategies we could use to improve that? So those are the things we need to finish for this year. They're not too hard, and we got 6 months, so it's not too bad. And then for 2026, goal area number 2, these are the things we're going to do in 2026. Under housing, we've done a lot of the housing goals. I think it's just kind of fun to look at this report and see how we did this. It's nice to see we're getting it completed. I don't know if I told you that I did a presentation. The state identified our local services plan 1 of 3 to be a model of what they wanted to see in a plan, to present on us. So they messed up the information. They had me presenting on an objective and goal that didn't come from our plan, but nobody found it. We're like, yeah, definitely had that. But so I think the process is something people are recommending, and we are getting a lot done. It's nice to see it. And this housing goal, goal area 2 housing, objective number 2, gather information about housing solutions, learn about current, new, and proposed housing solutions, including community-based residential programming, their challenges and successes that will better address our needs. Making sure we really understand what are our housing partners experiencing. And you'll see on that page in your plan, there's an ongoing section. And then what we've completed already. We really wanted to hold off on this housing goal because we've done a lot around it.
But there are a number of housing programs that are coming online in 2026. So we want to keep a watch out and see how they're working and what kind of help they might need. We have 2 ESHI programs, and I have to write that down, remember, Empire State Supportive Housing Initiatives. So they combined with Office of Mental Health. They have they have units that are going to be for people with domestic violence challenges, because we learned when the commissioner from DSS came and talked to us about how many people end up in the shelter who are fleeing domestic violence. So having housing that has certain number of beds that are for people with mental health challenges, people with substance use challenges, they're expanding it. So you can really start seeing that integration. A person can have multiple needs or just one need, and they're all fine. Like it may be a person who has a substance use need. It may be a person who has a mental health need. It may be a combination. It may be a person who has some physical needs, and they're trying to just make sure that there's enough housing for them. So RSS, Rehabilitation Support Services, they're fairly new to our county. They do care management services already for adults. They're going to do one of those ESHI programs. And Catholic Charities of Tompkins and Tioga, who came and presented last month about the program that we designed with opioid dollars, both with the city and with the LGU in partnership. They also will have more housing come online. And when that happens, they will be able to help people move from the very intensive housing that we established through our opioid dollars, and then they can go in less intensive housing when they're ready, but still get the support they need. So that's why we have that one on there, even though we've done a lot on housing, because we just don't have enough, and we have some new providers coming. Objective goal area 3, crisis services, and luckily we're in crisis services. We have for a while. I should have written down the page numbers. But it's objective number 3. And we extended this from 2025. And this is so good you're on the board, because this is about you in part, and the sheriff's office in part. And Larry, part of Larry's vision really is to see that the mental health subcommittee is participating actively in making sure that law enforcement hears the voices of people with lived experience who have had a mental health crisis, and continue to get that humanity piece of it. And that's what CIT training does, that last day with the panel. So they want to help with finding people in the community who could be on that panel, or maybe there's members of the members or people who regularly attend the subcommittee. They will work with NAMI. They will work with the Mental Health Association. They want to help do that. And if there isn't a CIT training, crisis intervention team training is for law enforcement officers, so that they have more information about mental health challenges that people might experience. And then it helps. Do you want to explain CIT? You probably do it better than me.
Sure. Actually, Tompkins County had hosted training 3 years ago now.
Yeah.
Where I came from had done a training when I was leaving. And really it's bringing all the different services together to work on filling the gaps. The Cornell actually did some training last year, and they're starting their CIT program up there. So getting all the people to the table to actually like problem solve, because there are so many different places. Our care teams, work with a number of individuals that repeatedly have calls for service generated, that some are by them, by their family, some are from the community. And, we need to do a better job of communicating with each other. There are a couple of cases as we're talking and discussing different houses that have closed. There are people in the community that would benefit greatly by having those supportive services. And when there's an emergency list that's like years long, these are people that are going to end up having police contact, whether one person in particular, very impressionable, probably developed in age, a 9-year-old, and he is taken advantage of by people. And on a daily basis, and he's actually housed in a stair, and he doesn't have the support that he needs to be successful. His parents kind of dumped him off in the community last year. And I mean, these are the gaps that we have, but we know like he needs better services. Another couple that's has some mental health concerns, that's on house, that is struggling with all the different services and actually getting where they need to be with housing. And last week they assaulted another couple who they're familiar with. It wasn't random, and lost their housing opportunity. And now they're still in the community without a lot of options. And they have all the different services that are there to support them, but there is nobody that's able to like bring the solution that they need at that moment.
So the CIT training starts with that, like a mapping exercise to see how do people flow through your system? Where are there roadblocks? And we did do one about 3 years ago. But you have to do it regularly, but you do that, and then there's training through the week for officers or deputies to learn about they learn about the mental health services available in the community. They learn about some strategies that can be effective to work with people. And the last day is a panel discussion with people with lived experience who talk about both some of the good and bad experiences they've had, and what was helpful and what wasn't helpful. And so I think that's really, it's just helpful for people to hear from people who know it best because they've lived it, and make sure that that compassionate piece is always there, and that people look at what is working and not working in their systems. Because when our systems don't work well, law enforcement gets involved. So the more we can improve the quality of the services we deliver and have them be coordinated, the less contact people are going to have with law enforcement. So that's a goal that the mental health subcommittee has. And if there is no CIT training, they have some other ideas, but they really do want to have that, get that one off our plan because they're going to run out of years.
It's not just law enforcement, it's having the other agencies at the table. There are things that law enforcement has training that sometimes the other professionals don't realize that exists. Sometimes we're the ones that are requested. They don't want to talk to the petitioner. They don't want to go to the hospital because they've been there before and maybe they weren't treated how they felt they should have been treated, and they're requested to go to another county. So a big part of this isn't just the training, it's getting everybody in the same room talking about, how can we, what are the services that are needed? And the modeling is something the one from, I think it's 3 or 4 years ago now.
Mhm.
It's still online. You can still find that modeling, but there's a lot of people or partners that have kind of dropped off the conversation.
Yeah, you have to do it frequently enough because your community changes, and hopefully we're getting some more with this new housing services coming online and new partners moving. You do have to do it regularly so people are all updated and know who everybody is and what kind of services are available, and understand the challenges that we're facing today, not maybe what we faced 5 years ago.
Is it a funding? Is it not happening because of a funding issue? It's not me, right, that provides CIT training? Or is it your team's bandwidth?
OMH?
OMH paid for training. They paid for it like the first year. We got a grant to do that. We had to rate something to get that money to do that. Because what the biggest expense is not the training per se, but it's covering the cost of overtime because when someone is going to this, somebody else is working. And that can be pretty expensive. I think we got about $25,000 to do it a couple of years ago, but OMH feels like, okay, we got you started. They want you to find money elsewhere.
Okay.
And we have a number of officers that are trained, and like last year, we sent a couple up to Cornell for their program. It really is the coordination and keeping that conversation. There's a couple different groups. There's a high risk conversation that started recently. There is another CIT meeting, but it's not this CIT.
No, right, it's confusing.
Right.
Yes.
That could be part of like kind of, some of the people and so that are in that participated in the training, so it's more or less to kind of bringing that conversation back to the forefront.
Well, can I just ask Harmony, I mean, within this, is it the intent or the goal to try to bring more CIT training to the county? Is that something that you and the committee have talked about?
I think it's really considered a law enforcement, like when law enforcement wants to have the training, like I think we're like the people that would, if you say like, if the police department said they wanted to do a CIT training, we would say, how can we help? Like, what's our role? What do you need from us? How can we be a strong supporter? I don't know if there would be an avenue for funding that we would have available to us, because when I've talked to OMH about it, they have said that they give the training dollars in the beginning, and then they expect you to find the dollars elsewhere. But I think we can provide other kinds of support, like getting the people to the table, knowing who to invite, making sure that there's voice from people with experience in agencies. A lot of the agencies attend our subcommittees, you know, and we could find whoever needed to be at the table and get them there. That's the stuff I think we could do. The last time we did, NAMI came and they purchased a book, and they purchased a number of like handouts for law enforcement to be able to give to family members so that they would know about all the services in the community. Because sometimes people forget about the family member who's watching a loved one in a crisis, and giving them, like, sometimes everyone wants to put everything online, but when you're in a crisis, you want a piece of paper. Or you want the magnet that you're gonna put up there for next time, or you want.
Not everybody has access the same way to.
Right, and not everyone that has internet access, it's not easy for everybody, so it's sort of like those things, because sometimes maybe one of our partners would have money to pay for some of those things because they purchased books for everybody. All the people that did the training, they purchased these magnets and these brochures and helped just create something that, and then again, because it's paper, because I think in a crisis, people lots of times want paper. It gets out of date, so it's got to be done again. Does that answer?
Well, yeah, no, I mean, the role of Whole Health would definitely be to facilitate it, to support it, not to do it. But there is potentially an advocacy component to that as well, right? To advocate for that kind of training to be more widely available in our community.
And what ideas do you have about how will we do that advocacy? How would you see us doing that?
You could discuss it here, and since we have the police chief, it's great to have him, but also with the sheriff's department.
Oh, I see what you're saying. Okay.
And I think that we talked about this a little bit earlier. I think there's also an element here of cost savings down the line for healthcare systems, right? Like the more that your officers are able to de-escalate or deal with a client or an individual who's having a psychotic break on the street and not just take them to the ED, A, that saves your officers time and paperwork. Right, that saves them having to sit there till they're admitted, right?
Yeah.
And it like allows that person to have a more stabilized experience and avoid the trauma of like moving on in the system. So I think if we can think about how to quantify some of those savings and dollar pieces, I think that also, you know, circles back into some of the advocacy we need to think about for these other pieces around like the lack of housing supports that is costing us more public safety dollars. That are more expensive perhaps than what we would have paid in paying OPWDD staff more money hourly. You know, I think there's some dots here that we can think about.
I think the funding that was offered originally to get officers trained, like a lot of that was around maybe agencies that didn't see the value, but okay, but you're gonna pay for the training.
Right.
We'll find the funding to get the officers there, right?
Yeah.
And we have the framework in place. I mean, it's time to sit down and reevaluate that sequential model. And to bring that working group to the table that can have these conversations. We had, my previous experience, we had people that were very well known in the community, and some were having experiences in the hospital that it was a revolving door.
Yeah.
Some of them didn't need to go. Some of them things were happening in the ER and people were getting sent right back out, that the administration of the hospital didn't realize that that was happening. And so there were corrections and things that happened that kind of helped restart. There were some cases that were just incredibly challenging, that you kind of bang your head against the wall and you couldn't find a good solution. But the more that we actually are working towards a solution, there's definitely better outcomes for people beyond the cost savings, but just a better outcome.
Well, I'm sure we can be creative and think about this, and this is part of what we'll be doing for 2026. And then the next one, let's see, we have just about 5 minutes. I have not, you know what, I only have like 2 left. I did it, I'm gonna do it soon. I don't need to do it. Oh, do you need to go and then you need, okay. We have objective number 5 in our crisis. Objective number 4 is to support efforts to establish a crisis stabilization center or similar program, and we anticipate that that will be done by February 2026. So it's just really a monitoring. And then objective number 5 is support suicide prevention efforts through the Suicide Prevention Coalition and Zero Suicide Committee. We did ask for an OTR last year. The Suicide Prevention Crisis Services made a presentation around having some coordination for the volunteer Suicide Prevention Coalition, and that was approved by the legislature. It was for 3 years, so the second year, now they're called enhancements instead of over target requests, went in as well to try and continue that work. And there has been a lot of stuff, a lot of really positive revitalization to the coalition as a result of having that coordination work being done. When you have someone who can be dedicated to it, you get a lot. And then objective number 6, under that area, determine if there is a need for a subacute limited law enforcement response model in addition to the newly established care teams that are a co-response. This is a new objective that we established. It says 2025, but we didn't establish it this year. We established in 2024, so I'll fix that. There may be state funding coming through what's called Daniel's Law, as Daniel Pruitt was killed in Rochester. He had a serious mental illness and there was a lot of law enforcement involvement. He ended up dying. There has been a lot of advocacy to try and have teams that are able to respond to people with limited law enforcement. So if they ever rose to the level of there needed to be a law enforcement involvement, they would get that involvement. But often many of these subacute situations can be handled before they turn into bigger situations. And that's the goal of that. And there is going to be money coming through the governor's budget, and it will come through OMH and request for proposals. So we need to be prepared when that funding comes to say we need it, we don't need it. If it goes for our size of county, it may just go to larger counties, but let's be prepared, basically. And then we have objective 1. We have for cross systems, we're working on objective 1, improve public awareness of available services across systems, including those that address social health needs. And we're going to talk about that anti-stigma campaign going in there. And then goal number 6, adverse childhood experiences. There's one goal in there, and we're going to continue the mental health. That's just the mental health subcommittee. They're going to be working on creating greater awareness of the impact ACEs have on both young people and adults. And then on the transition age youth, this was broken down in objectives by each subcommittee. Mental health is keeping this as a objective to continue working on because there is some significant challenges around not having any respite services for young people in our county that are having a mental health crisis or just need planned respite. There is none. And the one program we had in the county that supported a significant number of youth in the villages who were homeless no longer exists. And so we really have limited resources for young people who are homeless. So we wanted to keep that objective in there because while there's been work that has been very positive, we have Children's Act team now, we have home-based crisis intervention services now, which we didn't have a year ago. So we made a lot of progress, but we still have those two significant gaps. So any questions, any more information that people need? You want to vote to approve it? No. Do we have a motion to approve the local services plan that Harmony just went over for us? Thank you, Sheila. Second. Sally, thanks. Everyone in favor? Okay.
I would put my hand up, I don't think I'm approved yet.
Yeah. We're almost there.
Okay, thank you. And now we have a quick executive session. So anyone who's not a member can leave and we'll do that quickly and get people on their way. Motion to go into executive session. Russ and Sheila. Is this not being recorded? So like.
No, it just-
So if someone takes